Today we're going to be talking about the ACA repeals, and it's going to be interesting because it's harder than it looks. The Republicans realize the fact that, oops, even though we've been waiting for 8 years to repeal it, when we have to go and try to do it, it's somewhat difficult to do. So I'll be talking about the current state of ACA. It's still around. People thought 20 minutes after the election it would be gone, and it's still here, and it looks like foreseeable future. And Trump just announced that they're going to wait on tax reform until they get this done. So let's see what happens. Then I'll be looking at the effort to repeal ACA and Trump Care, why it failed, what happened, and then lastly, I'll be talking about what could happen in the future. I mean, all the different proposals, all the different things that could happen over the next few months and years, what could happen. So let's look at this. So let's look at the current state of ACA. This is what the healthcare industry looked like, healthcare coverage looked like in 2009. The green is employer coverage, the orange is Medicare, the brown looking is Medicaid, individual market is in the yellow, and then other non-group coverage such as student is the gray, and then the uninsured. So there were 48 million uninsured in 2009. Many people are uninsured for various reasons in 2009. I didn't have coverage in 2009 because I had a pre-existing condition. Nobody would insure me. That's one of the realities. And some people face that indication. So the patient protection affordability carrier has certain goals. They were going to increase the number of Americans with health insurance. Healthcare costs are number one reason for bankruptcy. ER visits are an average of 1,265. Broken foot average is 16,000. Cancer treatments 30,000 a year. Some can't afford coverage, and some jobs don't provide, especially if you're working for a small employer. Many people realize that if you're working for a small employer, you rather have salary than you would health insurance. And so some people couldn't get insurance for that reason. Some chose not to buy insurance. When I was in my 20s and 30s, I was going to live forever. So therefore, I didn't need insurance. And that same is true. And some want to buy insurance, but companies, again, won't sell them. And one of the reasons why, again, because back in 2009, there was a pre-existing condition. And if anything happened to you in the last 5 years, insurance companies were really tough to insure you, especially in the individual market. And lower the cost of health care on a per-person basis with cost controls. That was the goals of all this, and all the political stuff going on in 2009 and 10. And basically, when they structured Obamacare, there were three basic, for this stool, parts of it. There was the individual mandate, where individuals had to get insurance or they would be penalized. There were a guaranteed issue and community rating that was to lower costs, share the cost among the whole population. Under the health care that was in existence in 2009, there was a 9-to-1 ratio from younger people to older people. That was raised, that was lowered to 3-to-1 under Obamacare. And then to help individuals to get coverage, there were tax credits and subsidies. So if you earned under a certain amount, the government would actually help you if your employer didn't provide coverage in buying individual coverage. And to ease that, these marketplaces were created to ease the ability. The only way you could get a tax credit is buy your insurance through these marketplaces. And for a few years, they didn't work so great. So under the leg one of the stool, guaranteed issues, carriers must sell to everyone regardless of medical condition, age, pre-existing conditions, and the fact they can no longer ask for medical history. That was the big deal. People, and it also was a solution, but also it created another problem. It increased cost. The people that came in and wanted insurance are the ones that were the sickest. So that was an immediate solution, but there was also a problem. A community rating. Carriers cannot charge people different rates on the same policy based on any factors other than age, 3-to-1, location, and whether you smoke. That was the only factors that insurance companies, so if you had a history of cancer or heart condition, it didn't matter. You didn't get an increase, and so therefore, again, many people with chronic conditions came in and got insurance for the first time. And then, for the first time, before individual states would determine what are mandated benefits. So if you lived in Indiana, or Illinois, or Wisconsin, various states had various mandated benefits. Here, for the first time, the federal government had something called qualified health plans. All plans sold have to meet ACA standards, include at least 60% average value, and all 10 initial health benefits. And every one of them, and this is the biggest complaint, had maternity benefits on it. Even if you were single and 23, it didn't matter, you bought it and you had the coverage. And the philosophy was, well, if we include these 10 benefits, and for the first time preventive care was required, then people would get healthier. But as a result of these 10 essential benefits, it increased costs. That was the problem. So it was a solution because there are many cheaper plans with cheaper coverage, but the coverage wasn't that great in 2009. Now they mandated for the first time, the federal government, 10 essential benefits, but again, it increased costs. So actuarial values, all qualified health plans have to cover at least 60%, and these are the bronze, silver, gold, platinum, and as you went up the ladder, the coverage got better. So bronze was 60%, silver was 70%, gold was 80%, higher premiums, lower deductible, 90%, the highest premiums when there was no deductible. And then for younger people, there was catastrophic, 50% average value, very low premiums, insanely high deductibles, only available if you're under 30. All right? So these are the plans, and again, it was sold nationwide. And one of the complaints was, of course, it would vary from state to state because they were also added into the state mandate. So if you bought it in Illinois, it looked different than Indiana because of the state mandates. But again, the federal government layered on top of it various other benefits they had to include. And then the individual mandate. Everyone, with exceptions, have to have an ACA-compliant health policy for at least 9 months out of the year, or there'd be a tax penalty of $695, or whichever is greater, 2.5% of household income, with a maximum of $2,085 on the average premium for a bronze plan. And again, the penalty went up as years went on. I used to call it, should I buy coverage or buy a six-pack of beer? Because the penalty was very low for the first couple of years. Then it started getting higher. And the penalty is charged per month. And again, if you look at your tax return, there is a space on the second page asking if you have health coverage. And that's where you have to indicate the fact that whether you have health coverage. If you don't, that's when the penalty comes into play. Now, there are exceptions for various reasons. You're an expat, hardship, domestic violence victim, national disaster. So, I mean, they were pretty liberal in certain situations in waiving the penalty. But again, this was one of the biggest complaints because people thought, why should I be forced to buy health care and pay a penalty? And some people were complaining the penalty was too low. Other people thought it was too high. And the reason why it was structured this way, and it was tested by the Supreme Court, because if it was too high, it would be prohibitive, it would be a penalty, and they argued it was really a tax, and therefore it became constitutional. So the administration, when they designed this in 2009 and 10, were in a box, because if it was too high, it would be a penalty, and it would be unconstitutional. So that was the reason why this was all structured. And the third leg was the tax credits. Two types based on income. The advance premium tax credits, income between 100 and 400% of the federal poverty line. That's between $12,000 and $48,000, or $24,000 to $98,000 for a family of 4. As your income went up, the premiums went down. So the people with the lowest income that couldn't qualify, for example, for Medicaid, got the highest amounts of credits. All right. So subsidies increase as the benchmark premiums, premium up to 20%. And subsidies varies on the rating area. For example, the average premium, and this was in 2017, in Louisville, Kentucky, is $229 per month, but the average premium in Anchorage, Alaska is almost $1,000. So depending on where you lived, the premiums could actually vary. So the cost sharing reduction, there's other credits and subsidies, income between 100 to 250, that's between 12,000 and 30,000. There were various other reductions for deductibles, co-pays, co-insurance. So again, a certain segment of the population got these tax credits. But the biggest increase in cost and the biggest expansion of coverage, and the most controversial part of Obamacare, was Medicaid expansion. So here, expands Medicaid to everyone to up to 138% of federal poverty line, which is $16,600 for a year for individual, regardless of pre-ACA eligibility. 31 states and the DC expanded coverage. 19 states, all GOP held, refused to expand it, all right? And most of those states were in the South. 26 million people caught in the Medicare gap, didn't qualify for Medicaid, but earned too little to qualify for ACA tax credits. In October 2013, 57 million enrolled in Medicaid. In October 2016, went up to 74.4 million, the increase of 17 million. So that's where the expansion really came in under Obamacare, was the expansion of Medicaid. And this is where it gets really tricky, because once you give something eligibility for a benefit, it's kind of tough to take it away. That's going to be the problem. This is where the big sticking point in repealing all this. How are you going to cover these people? Because one way or the other, the problem is hospitals have to take people. If you go in and get service from a hospital and if you don't have any coverage, the hospital basically takes that on the chin and everybody else has to pay for it. At least these individuals had coverage. That was the argument that the administration used. You know, we're going to try to get people healthy. That's part of the problem. So other ACA provisions were very popular. No annual lifetime limits coverage for anyone in the individual and group market. All plans must meet a minimum coverage requirements. And again, this was a big deal because the fact for the first time the government got involved. As I said before, before the states would actually mandate benefits on the individual and group markets, and the federal government was not involved at all. And the biggest advantages, well, young adults can stay in their parents' policies until 26. So this was a huge expansion, and families could cover children. And again, it didn't matter, which was very interesting, whether these children actually lived with you, as long as they're under 26. And they could be married, it didn't matter. They could still be covered by the plan, the family's plan. So again, and also it closes the Medicare Part D donut hole. So these provisions were extremely popular. And again, in some form or fashion, Republicans have promised to continue some or all of these provisions. So in 2017, and compared that for 2009, the green, I guess, is an employer coverage. Medicare is the orange. Medicaid is the kind of brown looking. Exchange-based subsidy, unsubsidized and subsidized is the yellow, and that was non-existent. Other non-group coverage, including student coverage and other coverage, is in the kind of purplish blue, and then the uninsured for various reasons is in the white. So again, it went from 47 million to 27 million. They're uninsured. So again, they decreased the amount of, but the arguments from the Republicans, well, yeah, you have coverage, but again, for various reasons, all this expansion, yes, you have coverage, but it's too expensive to use. The deductibles are too high. If you have Medicaid, you may not have a local doctor that actually can take you because the reimbursements were so low. That was the problem. So yes, you have coverage, but whether you can access that coverage, that's another matter. So eligibility for ACA coverage among non-elderly uninsured, there's various reasons. Medicaid and other public eligible individuals. So there's various, what this slide is trying to show, out of that 27 million that were uninsured, there's various reasons why that those individuals are uninsured. Going from down from the left, ineligible for financial assistance due to income, ineligible for financial assistance due to employer-sponsored insurance, ineligible due to coverage to immigration process, and the coverage gap, tax, anything on the right, they would be eligible for financial assistance. 43% of those individuals could be eligible for financial assistance, but they choose not to get coverage. So you can lead a horse to water, but you can't get them to drink. So again, certain segment of the population, even if they're eligible for financial assistance, they still are uninsured and don't want to have coverage. So no matter how you design the program, as the administration found out, there's still a segment of the population on the right of that chart that still, they don't want coverage. So here are the pros of the Affordable Care Act. Lowers overall costs by providing insurance to millions. It increases the access of health coverage by expanding Medicare. Increases the access to health care by disallowing exclusions for pre-existing conditions, keeping kids up to age 26, limiting limits on coverage, mandating minimum benefit set, providing exchanges with tax credits. It didn't change the budget deficit, even though a number of governmental subsidized enrollees is increased because the cost controls shifting a burden to taxpayers, insurers, and others to defray costs, so other people were taking the burden. Ties Medicare MD fees to qualify measures in the future, and mandates implement of computerized patient records. So these are the pros of Obamacare. But again, the conservatives have certain objections, and they're valid objections. In the long run, what Obama did, it didn't address the increase in costs. Still, over the last 15 or 20 years, every year, healthcare costs increased, and Obamacare didn't do anything about that. If the employers opt to pay a fine, government subsidies to cover employees will soar. Increased taxes on income leads to fewer jobs and production savings. Huge expansion of government to the private sector yielding less coverage and freedom. One size does not fit all, and that was kind of some of the discussions today indicated that. Individual mandate is a loss of freedom. Mandatory community rating will increase uninsured by choice. Cuts on Medicare managed care organizations will decrease choice for seniors and decrease efficiency. And even today, more than half Americans want it repealed. So there are pros and there are cons that were, again, conservative objections. And again, there are legitimate problems with Obamacare. Medicaid, 19 states still haven't expanded it. Doctor hospital reimbursements are too low on Medicaid. That's why, again, if you're on Medicaid, many individuals don't want it because there may not be a local doctor or hospital that takes them. Federal feds cover 90-95% of the expansion, but only 50 to 75% of traditional Medicaid. States are constantly rating their share or missing with the program requirements, and eventually, over the next 4 or 5 years, the reimbursement from the federal government will decrease, and the states will be left holding the bag. Group coverage. Employer mandate ironically encourages job lock. We're also adding a bunch of paperwork and tracking employees. And again, ineligible due to employer-sponsored insurance. Employer plans glitch allows catastrophic plans left the table to disqualify employees. So basically what I'm saying here is that if your employer offers you coverage and you don't take it, you're ineligible for any credits and subsidies. And you didn't take it because you couldn't afford it. So that was the dilemma. So by employer offering coverage, it made the insurance on the exchanges more expensive. So again, these are the legitimate problems with Obamacare. Undocumented workers, ACA doesn't allow undocumented workers onto Medicaid or ACA exchanges. Medicaid CHIP eligible outreach obstruction by GOP officers at state level. Some people don't sign up for it. And the tax credit eligible and ineligible. In certain aspects, people thought that some of the credits were not, again, generous enough to encourage people to get coverage. It was still too costly for some individuals, and I've seen this where individuals had to choose between feeding their families and buying insurance. So again, the credits may not have been generous enough to encourage people to buy coverage. Now, the Republicans were lying in wait for 8 years. They passed over 60 bills to repeal Obamacare. The first thing the Republicans promised after the election of Trump is the first thing we're going to do, we're going to repeal Obamacare and replace it with something terrific. And it failed miserably. So CBO estimated that repealing ACA would increase the federal deficit by $145 billion between 2017 to 2025. The reason for that was again, when you repeal Obamacare, it repeals all the penalties, all the fees the insurance companies were paying, the employers were paying, and individual paying, and those funds are then gone, so therefore it increases the deficit. Despite the insurance gains and deficit, public is divided over the view of the law. Now it's 45% are in favor, 45% is against, and 10% said what? What's the question again? I don't understand. So again, even despite all the issues and problems with Obamacare, it's the devil you know versus the devil you don't know. And what the hell are the Republicans going to replace it with? That's the question that everybody's kind of nervous about, and that is reflective in this slide. People are really nervous to see what's going to replace it. So as Congress looks to reform and replace ACA, policyholders may wish to avoid the adverse consequences are coverage loss among the 20 million people who gained insurance, return to the era of pre-existing conditions, exclusions, denial of coverage, deficit increasing stemming from the repeal of the ACA revenue-generating provisions, and continued premium increases in the individual market. That's part of the problem. So these are all the issues that are swirling around the repeal of Obamacare. These are all the issues that have to be fixed in order to move forward. So what is Trump Care? Well, this was called the American Health Care Act that Paul Ryan had put together with assistance from the Trump administration. And let's see what it does. It defunds Planned Parenthood. Oh, that's right, they did a separate bill to do that. They went back to the states and did that. Defunds Medicaid Expansion starting in 2020. No new enrollees, current ones can't come back once they leave. Defunds cost-sharing reduction completely starting in 2020. Changes non-ACA Medicare to block grants. As it was discussed there, the philosophy is that the states have a better idea of exactly how to use the money. Changes tax credits from income-based to age-based. So they don't give an advantage to the lower income people. Because insurance increases as you grow older, that's how they base the tax credits. And tax credits no longer increase to match premium hikes, nor do they vary according to area or rating area. So again, this is the part of the problem. Changes aid bait from 3-to-1 to 5-to-1. So what that means is if I am a younger person and my premium is $100 a month, the insurance company can actually charge an older person $500 a month. Eliminates minimum 60% bronze requirement. So again, the federal government is out of the business of telling what insurance companies could actually put in their plans, and people are worried about the fact there could be junk plans. You're buying something and you don't really know what's going to be included. $9 billion over 9 years for states to have high risk pools, reinsurance programs, replacing money that they stole from the risk corridor program. And in other words, what they're going to do in this situation, for those that have chronic conditions and they can't get insurance, they're going to push, as it was in 2009, they're going to create state high risk pools in order to cover those individuals. And again, this is going to be at a higher cost. Changes mandatory penalty to 30%, 1-year premium charges for not maintaining coverage. One of the complaints of Obamacare was the fact that because they completely eliminated pre-existing conditions, and you could buy insurance at any time, the charge was where people were jumping on and off coverage when they got ill. If they needed surgery or they had some kind of condition, once that condition left, they dropped the insurance. If they got another condition, they would drop on. So the way to eliminate that issue is the fact, okay, if you have a coverage and you drop it and you drop for a period of a year, I think it was for 1 year, and you go back on, the insurance company can then charge you a 30% surcharge. So to eliminate the fact or discourage the fact of people jumping on and off. It wiped out 1/2 of the revenue to fund ACA, including the 3.8% investment tax on rich people and 0.9% Medicare payroll tax, and doesn't really replace it with that much. And again, as was told this morning, one of the proposals is both to decrease the individual and corporate taxes. So again, this is part of the problem. It would repeal the ACA mandates for standards for health plans, but this would not happen in 2020. And this really upset the Freedom Caucus in the Congress. They said, we're going to have Obamacare until 2020. Come on. We fought to replace this. Retains private market rules, retain health care marketplaces, encourage use of health savings accounts. The individual and employer mandates, which was highly criticized under this bill, would have been eliminated starting in 2016. So under the CBO score, and the CBO score really sunk the bill. When people saw this, people ran for the hills. 14 million would lose coverage by 218. Another 10 million would lose coverage to 2026, which means there would be a total of 24 million that would lose coverage. Just about all losing coverage would be low-income Medicare elderly, Medicaid, excuse me. By 2026, total uninsured would be 52 million, up from the current 28 million. Age-based tax credits would actually be somewhat better for some in the middle class, but devastating low-income and elderly. Premiums would increase on average additional 15 to 20% a year, and deductibles would increase even more two ways: lower average value requirements, and assistance would be cut off for lower-income people. Once people saw this, especially the moderate Republicans, they ran for the hills because this was really bad news. So on that happy note, what's going to happen? What's going to happen, and because, and this is the elements in this, which is very changed from day to day. So next week, this could change. My presentation in the last 2 months have changed 5 times. So as this continues, and again, I have a mailing list, a newsletter that I inform people what's happening. If you want a copy of it, just email me. My last slide has my contact information. I can send you information on this. So what could happen in the future? Repeal, replace, or just repair? That's going to be the issue. What's going to finally happen? So fix ACA problems, fix the family glitch. Other members should qualify for tax credits even if someone is covered by an employer-sponsored programs. Fix the skinny plan glitch. In order to avoid the 20% employer penalty, the employer didn't have to offer minimum value, it just had to offer essential health benefits, and these were glorified wellness programs. Restore risk corridor funding. This was the risk corridor funding was to reimburse the insurance companies. That's why these insurance companies are pulling out of the exchanges. They were promised money at the beginning. In 2010, the Republicans blocked it, and now they're pulling out of all these exchanges. So under these guaranteed CSR payments, House GOP brought lawsuit charging CSR payments are non-constitutional even though they're legally mandated. So that funding was cut off from the insurance company. Require all individual market plans to be offered in the exchanges. beef up the individual mandate penalty, which is not going to happen because I think if you increase it, it will be unconstitutional. And then beef up tax credits, which under this current environment, I don't see it happening either. Conservative reforms. Individual tax relief for everyone, regardless where they work, to buy their own insurance. Replace a tax deduction for employer contribution with a tax credit for individual coverage. No barrier to interstate insurance sales, so these are what the conservatives are actually looking at. Allow employers to convert from a defined benefit to a defined contribution plans, which means as an employer, I can only afford $10,000 a year. So therefore, I'm going to set up a plan. I give you money. You buy your own individual coverage, show me the receipts, and I'll reimburse you. Under Obamacare, that wasn't possible. What may be possible, especially for small employers, is saying this is defined contribution. I have a set amount to give you. You buy your own coverage, and I will reimburse you for that. Promote new group purchasing based on organization memberships and associations. That's possible in some states, but not all states. More consumer-directed options such as health savings accounts and flex spending. The problem with that is a certain segment of the population can't afford to contribute to HSAs. No matter how much you loosen the eligibility rules, they don't have the cash to put aside to spend money on health savings accounts. That's the problem. Extend rational pre-existing condition provisions in individual plans, rewarding responsible behavior. They're going to bring back some portion of pre-existing conditions. Okay, what they want to eliminate, again, people jumping on and off coverage. That's what they want to eliminate. Equal payment for traditional Medicare and managed care Medicare. Encourage states to set up high-risk pools and consumer-driven reforms. Provide Medicaid insurers with opt-out to private insurance. Increase fraud and abuse efforts on Medicaid. Encourage private savings and private long-term care insurance. Stop new tax increases, promote tax cuts to expand private insurance coverage. Here, some of the new proposals of the last couple of weeks. States could apply for federal waivers from several coverage requirements that President Obama's 2010 rule imposes on insurers. Waivers from the Affordable Care Act provision that obligates insurers to cover essential health benefits. And the current version of GOP legislation would erase the coverage requirement, which would let states reimpose their own. So they're going to push things back to the states according to these new Republican proposals. Let states determine the exemption of the law's requirement that insurers must offer coverage for people with serious conditions. And patients with high cost conditions like cancer or AIDS would be put in a segregated separate insurance pool, but their insurers could receive extra payments. So push the very seriously ill into risk pools so it doesn't affect the other parts of the population. This is for the administration. Stop cost-sharing subsidies. In addition to subsidized insurance premiums, the ACA provides financial assistance for deductibles and co-insurance with modest incomes. House Republicans have challenged the constitutionality of ad payments, and that could stop. The administration could stop those payments. ACA requires insurers to cover 10 categories from prevention, while the broad categories are written into law. Key specifics are spelled out in regulations. And again, the administration could weaken those rules. Through administration, through the IRS, and through HHS, they could do this. So again, the administration could propose changes to weaken those rules. So again, it doesn't require legislation. Alongside subsidized private insurance for people who don't have job-based coverage, the ACA expanded Medicaid with repeal efforts stalled. Some 19 states have refused the expansion. That gives the Trump administration the opportunity to stir the important changes so they could make changes to these programs, not requiring legislation, so they could weaken these programs. Insurance penalties on people who remain uninsured are the most popular. The Trump administration has already eased enforcement. And again, what the administration could do is say, we're not going to enforce this provision of the law, and for those with the individual employer mandates, don't worry about it. We're not going to enforce it, so don't check the box on your individual tax returns. Don't send it in the reporting requirements. We're not going to enforce it. So that's what the administration could do. So possible changes. The employer mandate. Possibly could be around 2017, 18, or 19. Good. Depends what happens over the next few months. Individual mandate could stay for 2016 or 17. The reporting requirement, which is the worst reporting requirement on earth, it's the most complicated. That could stick around for 2017 and 2018. Could still stick around, especially if they don't get rid of the employer mandate. The non-discrimination rules, there were supposed to be non-discrimination rules for insured plans. The administration, the Obama administration, never proposed rules, and the Trump administration probably will not, so that requirement is gone. Cadillac tax is probably going to be gone. It was delayed to 2020. Everybody on earth is against it, and I would think that's going to go away. Essential health benefits, that's one of the reasons for driving up costs, and I think that will probably be eventually eliminated. The question is, and which you have to look for, is what are they going to replace it with? What's going to be required? Is the federal government going to mandate certain benefits? And pre-existing conditions, are they going to come back under some reform? They're going to impose it in some situations. Look for that. Expansion of Medicaid, some way it's going to be gone. Either going to block grant back to the states or make some changes to it. Dependent age 26 will stay. The marketplaces will stay. The full-time employee definition will probably be gone. That 30 requirement had such negative effect on the employment market. Employers were purposely employing people 29 hours. Health FSA limitation, now the limitation is 2,600. That will probably be eliminated, so now if you have a health FSA, that limit will be gone. And I think eventually freestanding HRAs, where you don't have to sponsor a group health plan, will probably come back. Because they recognize small employers cannot actually sponsor group health plans, and the one way to give employees money is a freestanding HRA. Other changes, eliminated the expansion of 5,500. The DOL in the Obama administration was proposing that every employer that sponsored a health plan or welfare plan had to file a 5,500. That's going to go away. I think the wellness rules are going to be changed and simplified. Now they're just a mess between the HHS and the EOC. That's going to be changed. Contraceptive coverage is going to be gone. That's been mandated by Obamacare. I think that's going to be eliminated. And gender transition services, which were part of Obamacare, is going to be gone. So certain things are going to stay and certain things are going to go. Other changes on individual income tax, allow a deduction for individual premiums. They're going to limit or eliminate some deductions. Look for that, especially in the tax reform. Eliminate credits to broaden the tax base. Repeal or replace DOL overtime rules. Slow increases in minimum wage. Delay any pay equity or equal employment opportunity rules. Leave paid leave to states and local. There won't be a federal law in regard to that. I know Illinois has a requirement. Chicago and Cook County has one now. So you're going to see that more and more locally. And lessen enforcement of independent contractors in the gig economy. Many employers, because of Obamacare, when they hired somebody, made them a 1099 employee. I think that's going to continue, and the Trump administration is not going to stop it. So employer-sponsored health care. Mandates may stay 2017 and 18. Reporting will be in place for 2017 and 18. HSAs and HRAs would be favored. On retirement income, reporting and fiduciary role may change, limits may change, and because of lowering the individual tax rates, Roth, 401k, and IRAs may not be favored because with the lowering of tax rates. Are there any questions? Poof. That's my contact information. Any questions? And it changes on a daily basis.